Good afternoon. Thanks very much for your patience. I'm the last. I hope I'm not the least, but we shall see about that. I've been from very impressive presentations. So I'm here to talk about global health and the crisis in global health. As many of us know, there is a crisis going on in a world where 70% of people living with HIV live in sub-Saharan Africa, and 60% of those people don't have any access to life-saving treatment. In a world where 80% of the deaths caused by cancer, pulmonary disease, heart disease, and diabetes are taking place in low and middle-income countries. Diseases that we think of as rich diseases are now becoming diseases of the poor and vulnerable. We're living in a world where to be rich, white, and non-immigrant is to be in a world where you can be healthy and wealthy. This is not an equitable situation, and my reason for being a practitioner and coming into the academic world was to try and start to find some answers to that based on my experience. So one of the issues that I identified through my years of work, mainly with Médecins Sans Frontières, was that global health governance, which is the system that we have globally, which is meant to make sure that health is something that all people can aspire to throughout the world, namely through the World Health Organization, which is centered on the role of states. That system now is outmoded. It doesn't function anymore. It's not able to address these inequities. And one of the reasons that I've been seeing for that, particularly through my work on access to medicines, is that there's this conflict going on between private economic interests and the public health needs. It's a situation that we get to where profit is put before the lives of patients. So my hypothesis for my master's thesis was that acknowledging this growing influence of the economic interests of transnational organizations in global health, maybe we can start looking at ways to talk about accountability and transparency and work towards an equitable participatory governance system, which will allow the global health to go back towards the social justice goals that it initially set out to promote. So where is this thinking? I'm a lawyer by background. The thinking started in human rights. In fact, it's strangely enough, when law is usually the conservative, slow one, in this area it's actually been a bit ahead of the game. People now are really starting to talk about the human rights responsibilities of businesses when they work overseas, and starting to say when they do that, they have obligations which we can actually ascribe under law, which we can assign to those organizations. So what my thesis is looking at is how to transfer those international legal obligations into global health governance, and how, therefore, we can bring the idea of accountability and transparency into global health decision-making and make it once more equitable. I'm doing a case study on the non-communicable disease crisis, which was the cancer, diabetes, etc. I mentioned before, where I actually witnessed how the pharmaceutical industry was able to come into the process and change the results of the political declaration that the countries made, which favored the business interests over and above the social justice needs. I agree with the idea of a whole-of-society approach to a deal with global health, which is the approach that's promoted by the World Health Organization. But we need a whole-of-society approach that's equitable, that's multicentric, that's socially just, that's accountable and transparent. And I wanted to look at the lessons that I had received from Médecins Sans Frontières, which is an organization which strives to always keep the patient at the front and the center of its global policy making. And I hope that we can do the same thing in global health governance. Thank you.
All of you have very what I would say, outside the traditional way of approaching your research within traditional programs and departments here at McGill. Was this a difficult venture for you to go on the types of research that you're doing, or was it relatively easy?
Yeah, I'm doing a joint master's degree with law masters with bioethics, and I think the interdisciplinarity there is really strong. And I think actually McGill is a place that's very open to interdisciplinarity, and I've found people very open to my approach coming from a practitioner approach, now moving into the academic world.